To my fellow veterans, even though we're a day early, being an old Marine Corps sergeant, first to fight, first to start talking about Veterans Day, and today is the Marine Corps birthday, so it's my it's our second birthday. I don't look a day over 250 years old, right? So 250 years of the United States Marine Corps began in Tun Tavern on November 10th in 1775. And the fellow Marines out there can testify that we may not look 250 years old, but after all of that running and forced marches, our knees definitely look 250. They feel like 250 years old. Okay, so we're going to talk about all things. We're going to get into a bunch of live questions. If you're a vet, you know a vet, please share this video, and that way they've got to know, they know they have a place that they can go to when they have a question about Social Security, Medicare, Medicaid, whatever the case may be, and we can see if we can help them out. But you vets out there, please ask any questions in the live Q&A. We're going to get into Social Security disability insurance, how that works with your Veterans Administration disability if you have, retirement, Medicare, whether you should keep Part B. That's a big one that everybody has. So let's go ahead and get right into it. All right, so we'll start off with Social Security disability insurance. Your veterans benefits does not affect Social Security disability benefits at all. The only way it affects it, it makes it a little bit easier to get Social Security disability insurance. Why is that? Is because when you apply for it, you have to go through the entire program, the entire process, and it takes months and months and months and months, but it's a little bit quicker for veterans because the Social Security Administration, the DDS, the Disability Determination Service, those are the people that actually make the medical determination. They're a statewide agency, they're state agencies throughout the country, and they have a better system to connect to the VA. So if your medical records are predominantly with the VA, it's a little bit quicker. So that's good. For everybody else that has, doctors throughout the country and hospitals and clinics that they go to, that's one of the reasons it takes so long to get approved for disability is because they have to get your medical records. You don't necessarily have to provide your medical records. They get the medical records for you. Social Security does. But that's what takes time is they send it out to particular doctors and hospitals, and it takes the time for them to get everything together and respond, and sometimes they do and sometimes they don't. So, but anyway, for veterans, it's a bit easier in that regard. There's also, if you're called a wounded warrior, your case is expedited. So if something happened to you in the line of duty, then you could be considered a wounded warrior. You just mention that you're a vet, and then you're wounded in the line of duty, and they will ask you some questions to see if you qualify for that expedited decision. Okay. If you are receiving veterans disability benefits, that does not affect, the money amount does not affect your Social Security disability benefits at all. They don't ask you, okay, well, how much are you receiving disability benefit from the VA? 10%, 20%, how much is that? Okay, that's going to reduce your veterans, that's going to reduce your Social Security. No, that does not happen. Might happen on the reverse. I think there's a bill in Congress that's talking about having that affect your veterans benefits. But as of right now, it does not affect your Social Security disability benefits. As for being approved, a lot of veterans say, well, the VA has already approved me for disability, so to get Social Security disability should be a piece of cake. Unfortunately, no. It's quicker in terms of getting a decision because of the medical records, but the VA has different disability criteria than Social Security. My office, I ran the third busiest Social Security office in the country and had a bunch of veterans. Guy who ran it, old Marine Corps sergeant, myself. And so we had a bunch of veterans that were receiving various levels of disability from the VA, 10%, 20%, 30%, 50%, and they were still working. And therefore, for Social Security purposes, they were not disabled. In order to collect Social Security disability, you cannot work substantially because of your disability. Your disability has to last 12 months or longer or end in death. So the completely different categories, eligibility requirements. A lot of veterans say, well, it should be easy because I'm already getting, 50% and 100% or fully disabled from the VA. No, you still have to go through the same process. Okay. What about retirement benefits for Social Security? no relevance in terms of being a vet. The only thing that you should do is when you file for your retirement benefits, make sure you notify them that you were a veteran. And sometimes they get you a little bit of extra credit. It's usually for those people that were back serving, in the 70s or before. At that time, people in the military, active duty military, did not pay into Social Security. And so they rectified that, and they said, okay, if you were serving in the military, they give you a few bucks extra. But hey, a few bucks is a few bucks is a few bucks. So when you file for retirement benefits, make sure you notify them that you were a veteran. You might have to provide your DD-214. Every good veteran always has a torn up copy of their DD-214 somewhere, somehow. So just show them that. If you don't, you can go onto nara.gov, NARA.gov, and request your DD-214, and that way you have it ready. Okay, here's the big one that a lot of people are asking. We've got a bunch of people. Nancy says her family was in the military pretty much on all sides. You got someone buried in Arlington National Cemetery. Isn't that the center of the universe for Antifa? Is the Arlington National Cemetery, all the people that fought during World War II against, anyway, so... Anyway, the use of words. George Orwell would be rolling over in his grave with the use of words in America today. But anyway, all right. So what about Medicare? Should you get Medicare? That's the number one question asked all the time. I have VA. People ask me, I say, hey, I've got VA or I've got Tricare. All right, let's separate these. If you're not a veteran, you might not understand the difference. Tricare is for people that retired from the military. So like myself, I'm not eligible for Tricare because I only served 8 years. As I always say, that's like 20 years in all other service, so it should be count. Anyway, but I only did 8 years, so I didn't retire from the military. So I wouldn't be eligible for Tricare. But if you actually retired from the military, full retirement or like a disability type of retirement, then you are eligible for Tricare. You could be eligible for Tricare. And that's kind of like a Medicare supplement. So if you have Tricare, you pretty much don't need anything else. You need Part A and Part B. Medicare Part A and Part B. They make you sign up for Part A and Part B. It's a typical government. The VA is trying to move costs over to Medicare, and so they make you sign up for Part A, Part B. So Medicare pays for part of your, and the Tricare covers the rest. So it's kind of, so you have like Part A, Part B, and Tricare is like a Medicare supplement that everybody else can get when they turn 65. Some people, after they turn 65, is like a Medicare supplement plan F or a G or an N. So you don't need anything else. You definitely don't need to pay money for a Medicare supplement plan. Completely throw that out the window. You don't need a Medicare supplement plan. Some people get a Medicare Advantage plan, and there's some Medicare insurance agents trying to make some extra money and try to sign you up for a Medicare Advantage plan. Chapter, they sponsor our channel here, and they don't recommend it. I don't recommend it. Some people do because they want the gym membership, or I don't know, but it's usually more trouble than it's worth. So you got Tricare, you're good. Okay. What about all the other veterans that aren't retired? They just stopped after 4, 8, 10, 12, 18 years, or whatever the case may be. And if you're eligible for VA care, VA medical, and you use the local VA clinic, then that's the big question people have. Okay, here's what everybody always asks. I use the VA, and I'm happy with it. It's close by, and I don't want to keep paying for Medicare Part B. Should I cancel it, or should I even sign up for it when they turn 65? It really depends on your particular situation. You don't have to. The veterans out there know you don't have to do anything in life, but the repercussions are X, Y, and Z, right? Push-ups, 10-mile run, whatever. The repercussions are, if you don't sign up for Part B when you're supposed to, and then you change your mind later, or life happens later, then you're going to be penalized for the rest of your life. 10% for every 12 months you did not have health insurance from current work, not VA. VA is not creditable coverage. You actually had to have health insurance from current work, years of your spouse's, and that employer had to have 20 or more employees. Then you don't have to sign up for Part B and no penalties whatsoever. But VA is not considered creditable coverage. So here's the situation you need to ask yourself. Okay, let's say you're 67, 70 years old, and you're approaching 65. Should you go ahead and sign up for Part B? Part A is once you sign up for Social Security benefits, you sign up, it's automatic at 65, zero premium, so nobody ever has any questions on that one. But Part B, the $185, you're trying to save the $185. Should you sign up for it? You say, I'm happy with the VA. It's close by, all good. Why should I wait? Why should I spend the $185? Because life happens. You like the VA now, but as you saw in the news, they tried to cut back 85,000 people from the VA, and then others out there, including our awesome community here, pushed back on that, and they said, okay, well, yeah, we're not going to cut 85,000. We'll cut about 35,000. We'll do, the old Rambo, win by attrition. They're just not going to hire anybody and let people go, and so they're going to do it kind of under the rug there a little bit. So long story short, the VA care is going to be reduced, and you might be happy now, but a year, so 2 years from now, what's going to be the situation? Or if you move and there's not a VA clinic, or they shut down the local VA clinic in your area, or you want a second opinion outside of the VA system. So there's a lot of situations where you just might want to have a fallback, and that is Part B. And you never know what's going to happen. So there are options out there. If you really can't afford Part B because of the $185 or wherever it's going to be next year for 2026, then there's Medicaid. That's a low-income, low-resource program that's administered by the states. It's a federally funded, state-administered, also state, both. It's a federalist-type program, state, federal. But it's low-income, low resources. So if you're having a really hard time paying the $185, you can apply to Medicaid through the state, and they have what's called the Medicare Savings Program. If they approve you for Medicaid, they will pay your $185, and then you'll get some other benefits as well. Okay, so you can have the VA, and you can have your Medicare Part A, Part B. Part D, the VA does a really, really good job with prescriptions because they're able to negotiate with pharmaceutical companies. So, prescriptions for VA is usually the VA is very, very good at prescriptions. So Medicaid, if you're really having a hard time with Medicaid, then that's an option. And then there's another option too. They're called Medicare Advantage Part B Give Back, but they're also kind of they're honor plans or Patriot plans. So you can see those are the name of them, kind of like honor plans, Patriot plans, or some other throughout the country. And they're directed toward veterans who predominantly use the VA. So they are MA only, Medicare Advantage only. Most plans out there that people have in our community here, if they have a Medicare Advantage plan, they have a MAPD, Medicare Advantage with a prescription drug. Most people have an MAPD. Veterans, if they get one of these, the honor plans or the Patriot plans, they have just the MA part. They don't have the prescription drug part because they get their prescriptions from the VA. And those plans, depending on what's available in your particular area, they just might pay for all or perhaps even part or all of your Medicare Advantage, or excuse me, your Part B premium, that $185. So they might pay $50 of it, $100, $150, $185, all of it. Depends on what's available in your particular area. So they're called honor plans, Patriot plans. You can reach out to Chapter or anybody you know and trust that's a broker that covers pretty much every plan in your particular area, so they can search for every plan in your area and see what's best for you. So that's what I would do. Medicaid, or get one of these honor Patriot plans, or a Medicare Part B, Medicare Advantage Part B give back plans. But the trick on those is with all Medicare Advantage plans, with veterans, with everything nowadays, you have to keep up on them. You have to be persistent and fight for your rights. If they deny you a prior authorization, the old, military story, if you go in there and get your left leg, worked on, they accidentally work on your right leg, and we've heard the stories. You always have to fight on everything on this, whether it's the government or private companies, particularly insurance companies. They're trying to make a buck. So you have to fight every step of the way. And that's one of the reasons we recommended Chapter Medicare, is they help you fight in terms of Medicare Advantage plans and prescription drugs and all the rest. So if you want help from them, make sure you call them up and you have your providers, prescriptions, your pharmacy that you want, your priority. Focus on prices, but stay persistent. And they help you throughout the year and make sure that you're treated right by whatever company you do ultimately choose. It's completely your decision. So again, you don't have to sign up for Part B. If you've already denied Part B and you're past, 65, and you should have filed for Part B a year ago, 2 years ago, 3 years ago, and you're like, wow, I guess I'm over. I can't do it. You can, but you cannot sign up for Part B until now the general enrollment period. With Medicare, all that Medicare plans and supplements and Advantage, the enrollment periods are a nightmare. Nobody can understand the rhyme or reason of it. But anyway, for Part B, you can sign up January, February, March. So if you declined Part B a year ago, 2 years ago, 3 years ago, unfortunately, you're not going to be able to join it until January, February, March. So you join it in January, and then your Part B will start February 1st. And at that time, you have to have Part A and Part B to get a Medicare supplement or a Medicare Advantage plan. So when you sign up for Part B, it starts February 1st. Then you try to find, whatever else you want for your particular situation. Okay, so again, you can reach out to Chapter and they can help you out there. All right, let's get into some questions. Someone's helping some other people out. We have the best community on the internet that during this live Q&A, people answer other people's questions and help them out. And we're setting up a platform so they can do that 24 hours a day. Likely have to pay a 10% Part B late enrollment penalty for every 12-month period you were eligible but didn't have coverage. Yeah, as canceling your Part B while abroad. Yes, Danny, good addition there. There's a lot of veterans that move overseas, immigrate overseas, expats, whatever the case may be, and that's the question they ask as well. Okay, I'm living overseas and I have health insurance in this other country that I'm in. Is that considered creditable coverage? Mostly no. There's a few countries, I know the popular ones like Philippines, a lot of people from the Philippines, no, Filipino health coverage, national health coverage does not count. It's not creditable coverage. So if you cancel it, moving overseas, and then you decide to come back because of typhoons and earthquakes and terrible ones in Cebu, and then you decide to come back, again, you can't sign up for Part B until January, February, March. And then you are going to be penalized 10% for every 12 months you didn't have it. Again, a lot of people, they move overseas and they say, well, I'm never coming back, so why pay $185? And unfortunately, life happens while you're making other plans, and then they come back. But Murphy's Law, they get sick in April, May, June. So that means when they come back, they won't have Part B until February 1st. Again, unless they had health, creditable coverage. But if you're living overseas, most countries are not creditable coverage. Let me say, I called many individual Medigap companies' plans. They said for Part G, the plan Chapter gave me from it is cheap. $197 is cheap. They said I could not pass this opportunity up if a guaranteed letter. Yeah, if you have there's a lot of people, close to 1 million people that got canceled from their Medicare Advantage plans, because a lot of Medicare Advantage plans, as Ari points out when he joins us here from Chapter, he says these companies are in two modes, one of two modes. They're in their expansion mode or they're in their margin mode. So expansion mode is, they're giving out all these goodies in their Medicare Advantage plans and, gym membership and dental and vision and trying to get as many people to join their plans. So they were in that mode last few years. Now they're in their margin mode. in the sense of they're trying to make as much profit from each particular person as possible. They don't care too much about total numbers. They want to make money as much as possible on each person. So because of that, they're cutting back. A lot of these companies are cutting back the PPO plans, the preferred physician organizations, preferred provider organizations. And because that's costing them more money. So a lot of people, close to 1 million people, are receiving letters that are saying, yeah, we just don't like you anymore. We're not making enough money off you guys. So bye. So I call it the golden ticket. Somebody asked me about it one time and I said, I forgot I called it the golden ticket. So it's your golden ticket to get a Medicare supplement plan. It's a guaranteed issue. On the bottom of the letter, it says, yeah, bye. We're leaving you. And because we're leaving you, you have this opportunity to get a Medicare supplement plan without health underwriting. So you definitely need to kick it around. It's not for everybody. If it's not in your budget, it's not in your budget, but at least call up chapter or whoever and say, hey, I've got this golden ticket here. It says I have this guaranteed issue. How much is a Medicare supplement plan in my particular area? Which one can I get? How much does it cost? And if it's within your budget, snap it up. If not, then you need to find a new Medicare Advantage plan. Let's see. Focus Lady, what's up? A member here. We've got a few people that joined us today, became members. And someone asked, do I need to be a member to ask a question? No, you do not. Unfortunately, I get hundreds of questions that pop up there, and hopefully I will see your question. I just saw that question. I didn't see your actual question. So if anybody sees her question, let's please let me know. My college roommate was Alan Greg Rogers. He made a huge difference for military service members. He passed away in the Iraq War and had a full military funeral. Gosh, I'm not too familiar with him. I've heard the name, but let us know exactly what he did there. I'm trying to remember this is live. Prices of Part B different between New York and Tennessee, for example? No, it's Part B is Medicare. It's exactly the same throughout the country. Hawaii, Alaska, Tennessee, New York. Yeah. This year it's $185. As of right now, they haven't come out with the official number for 2026 yet, but when they do, I will definitely talk about it. Let's see here. Also got some video questions. Glenna, well, hello. All I've learned the hard way. My body warranty wore out at 65. Yes. Yeah. Engineered obsolescence in sometimes, right? Yeah. In some sense. Has there been a change for the $185? Not officially. There's a lot of people talking about the Part B for next year is going to be about $206, but yeah, we don't know until we know. So, all right, let's see. Crypto Cypher, happy Marine Day. Thank you. And Brian, chapter saved me over $4,000. Wow, good deal. Wow, that's pretty awesome. Yeah, if you're having a hard time, some people are still having a hard time getting into chapter. You just have to be persistent. They are super, super popular. Everybody wants to use their after service, help, because these Medicare Advantage plans are nickel and diming people and making you jump through all kinds of hoops and stuff. And so if you don't have help, we try to help as much as we possibly can here. But these plans are different throughout the country, and you really need help sometimes. If you get a prior authorization, you get a bill that is incorrect, they charge you for something, and you need to find a new doctor or something. So a lot of people are reaching out to chapter from our community here, and yeah. So but if you try a few times and you're still not able to get in, make sure you email me, and I'll send that to them. And make sure you include your phone number, because they cannot contact you unless they can prove that you contacted them first. They do things the right way, like all these other stupid companies out there that call you, 50 times a day, and they're not supposed to. But chapter, if you send me your phone number and they can't find it in the system, they're not going to call you. Yeah. So you have to call them first, and then send me send me an email and said, Ed, I've called 3 times and I still not able to get any help. And include your phone number. I'll forward it to them. They will look in the system, and if they see that you called them, then they can call you. So yeah, they do it right. if you have an Advantage plan, did I deny Part B? No, you have to have Part B in order to get a Medicare Advantage plan, because that's where some of the money, again, this is why you have to fight. People say, well, I feel bad about fighting the Medicare, my Medicare Advantage plan because, they're giving me all this stuff for free. It's not free, it's zero premium, but there's back end costs. And no, that's 100% incorrect. That $185 you pay out of your Social Security check, wherever, it gets routed right back to your Medicare Advantage plan. All that money you paid into FICA for all those decades goes into Part A. General taxation, about 75% of Part B comes from just general taxation. So all that money comes from all these different areas. And then the government, once you sign up for a Medicare Advantage plan, they pay that Medicare Advantage plan to take care of you every month. So an average enrollee in the regular area in the country, they pay that company $1,000 a month. And you're saying, oh, no, I feel bad about fighting, this because they charged me too much, or they did this, or they did that. No, I feel that, they're really nice to me. They're giving all this cool stuff for zero. No, you paid $1,000 a month for what you're getting. Go out there and get it. If you're really healthy and live in a cheap part of the country, it's between $500 or $700 a month. These are average generalizations. If you're super sick and you're expensive part of the country, they're paying the government is paying your money, $2,500 of your money every month or more to that Medicare Advantage plan per member per month. That's what the PMPM stands for. So don't feel bad about fighting these. Anything, Social Security, Medicare, anything. Fight. That's unfortunately, we've got trillions of dollars of tax breaks to the richest people. And so we all have to fight nickel and dime and everything to get whatever we can. Major metropolitan hospital, excellent teacher union insurance. Okay. So you have, so a lot of those private companies are also moving to a Medicare Advantage plan. Someone said today that they called up Chapter and they followed my 7 Ps. And the number one is to have, if you have a Medicare Advantage plan right now or whatever plan you have, is to compare, okay, here's what I have now. And then Chapter will look at your particular area and they'll say, okay, here's what's available to you next year. And let's go over your providers and prescriptions and pharmacy and all that kind of stuff and narrow down from the 10, 20, 30, 40, 50, 60 plans in your area. Let's narrow it down. And they said, now let's compare it with your particular plan. And someone, I think it was in a YouTube comment or something, they said, Chapter couldn't find my plan. I didn't have the details of the plan and my Chapter couldn't find it. That's because a lot of companies are, trying to save money on retirees by, before, remember the old, after 20, 30, 40, 50 years working at a company, you get, you get health insurance forever, and then you get a gold watch, right? Gold watch, no more. But in terms of health insurance, they used to cover you like you were before, but now they're kind of camping that out to Medicare Advantage plans so they can save money on retirees. And they devise their own. They get with whatever Medicare insurance, Medicare Advantage company, and they design their own Medicare Advantage plan for their company retirees. And it's not available to anybody else. It's just available to those particular retirees. So that's why Chapter, anybody like that, they really can't find those. If you have a Medicare Advantage plan that's available to anybody, then they can find it, no problem whatsoever. So Carolyn, I received 30% of my SNAP benefits during the government shutdown. I hate the Democrats folded and voted to reopen the government. They should have held the line against the GOP. Yeah, I've got a, they were saying, oh yeah, they want to, do this so they can give more money to illegals. And then I've got a little clip here that shows, yeah, they knew it was about the Affordable Care Act. And so I'll show another little clip I found today of Dr. Oz. Yeah, anyway, my advantage was saying I don't qualify for this guaranteed letter since they merged my current plan. I thought the plan they merged are supposed to be the same, and they're not. And they're not. It's crazy. Yeah, if they kind of merge, they kind of play games a little bit. But if you've got that letter, that letter is the the key. So anytime there's a Medicare Advantage plan that has a particular plan, they have to get that approved from CMS. CMS says, okay, here's what, here's what you're supposed to provide in your Medicare Advantage plan because it's a replacement for Original Medicare, and Original Medicare covers this, so a Medicare Advantage plan also has to cover this. So they have to get it approved, and sometimes they play around a little bit, and so yeah, it's unfortunate. Ready for that special day? We are, because defending democracy is what we're all good veterans are trained to do. Yeah, that's what it's all about. Well, once you get down into the into the hole, it's always protecting the guys next to you, right? So, Willy Wonka golden tickets. I didn't want an Advantage plan, but they switched me. Yeah, not sure. Yeah, if you can't get a Medicare supplement plan, and unfortunately, a lot of people are in that situation after they turn 65. Once they turn 65, so once you turn 65, you can get any plan you want. But after that, then it's more difficult. You have to go through health underwriting and stuff like that. So if you didn't want an Advantage plan and you wanted a Medicare supplement plan instead, I would definitely check that out. If they're not supposed to force you. I know with the Affordable Care Act, there was a bunch of insurance agents that were tricking people and they were switching plans on them just so they can make more money. They finally closed that down. So, Tammy, I was told that all Medicare supplement plans have the exact same coverage no matter if it costs a lot more than others. Is this true? That is 100% true. All Medicare supplement plans, that is, there's different Medicare, there's about 10 different types of plans. But if you have a Medicare supplement plan G in Florida, it's the exact same as in Texas or California or Arizona or Washington. A plan G is a plan G is a plan G. There's a couple of, Wisconsin, Minnesota, and Massachusetts, they don't have like G's, they have similar type thing. But the rest of the country, if you have a plan G, it's a plan G, it's a plan G, it doesn't matter who it is. If you have a plan N, it's a plan N, it's a plan N, it doesn't matter who it is. Yeah, it's all based on price. So it's all price. And you can change your Medicare supplement plan. You don't have to, wait till now. For a Medicare Advantage plan, you have until from October 15th to December 7th to switch your plan, to review your plan. And then once you switch it, then it takes effect January 1st. With a Medicare supplement plan, you don't have to wait till now. If you have a Medicare supplement plan G and you want to see if you can save some money and find a cheaper plan G, then you can do that any time of the year. You might have to go through health underwriting, depending on your state, which sounds scary, but it's not. So they just ask you a bunch of questions, and if you answer no to most of them, then you should be good. Haley, if it makes a difference for any, I was given a screenshot that Olive Garden would give free meal to anybody with a food stamp card. Oh, okay, cool. Yeah, then Veterans Day, there's a lot of places out there provide free food for us vets. So absolutely. Yes, reminder tomorrow, there are many restaurants. Yes, thank you, Retired Cat. Absolutely. Go out there and take advantage of it. Let's see. Someone who's having a problem, again, with Chapter. If you have a problem with Chapter, please email me and let's check it out. ed@mygovexpert.com. Anytime my son and I find someone to help y'all out, and if they're not doing the right thing, please, please, please let me know. So email me and we'll get it fixed. Plan G covers anything Medicare approves except that $257 deductible. That's right, Plan G. So if you have a $1 million procedure and it's medically necessary, then yep, you pay $257, the deductible. That's it. So let's see. Let's get into some video questions. We got tons of video questions today, so let's go ahead and see what we got. Hey, by the way, I called last year and y'all gave me incorrect information. So if you're recording a video, please turn off TV, turn down TV, particularly if it's me. I hate hearing my own voice. So shut that guy off. Me. That's me on the background. Shut me off.
Married to the same man twice, but each time was less than 10 years, but added up total was more than 10 years. Can I still file under him?
Okay, I haven't, yeah, we haven't got into this question in a while. 5% of people out there remarry. I looked up the statistics one time. About 5% of people remarry the same person that they divorced. Okay, so if you're married, so in order to collect divorced spouse benefits, you had to be married 10 years. There's no exceptions. And there's, you might be common law, but that's considered, the state considers that marriage. So it has to be 10 years. It has to be 10 years. But there's one in there is if you were married to the same person. So for our viewer there, if you were married to that person for 5 years and then got divorced and you remarried that same person by the end of the next calendar year. So like if you divorce this person today, November 10th, 2025, and you remarry that same person by December 31st, 2026, and then are married for at least another 5 years, Social Security can actually add those two periods of marriage together to equal 10 years. That's an exception most people don't know about. And so please share and subscribe and like. And so this goes out to more people. And I'm sure there's people out there, thousands of people that, that can get these benefits that don't know. You're going to have a little bit of a battle when you go into the local Social Security office because, the people that were super experts got fired or, by Elon Musk and Doge or moved out of the system or vacated from the premises or whatever. So you just have to fight a little bit and say, no, you need to double check POMS. You need to double check policy because it is in policy that if you get remarried to the same person, but most Social Security and the people, the experts that are now pretty much gone, they knew it. Now it's just, it's bad out there. All right, let's see what else we have.
Hello, Dr. Ed. I'm 50. I'm on SSDI. I've been on it since 2017. I have a payee and a caregiver, and they help me with my CDRs. I really don't remember the last time I actually sat down and filled out a CDR by myself. So I don't know how often they come in because they normally do most of that for me. In 2026, with all these changes, are the impact of the CDRs increasing still going to impact me as much because I have a payee and a caregiver, or will that be some kind of exception and exemption that I'll see more to my regular schedule? Thank you very much.
Okay. Yeah. So the CDRs, the continuing disability reviews, CDRs are for people on disability benefits, and every now and then they check to see whether you're still disabled. So that's going to be increased. I got word from the inside that they're going to be increasing CDRs substantially going forward without any staff to do them. So I don't know how they're going to do that. But anyway, I think they're just going to send out paperwork and see what happens. It's crazy. But no, there's no exceptions. If you have a representative payee, you have some organization that helps you with the CDRs, it's not going to change whether you're going to get a CDR or not. It's just unfortunately kind of the luck of the draw when it comes around to your particular cycle. So just expect it. But don't, as I always say, don't sweat it until you actually get it. Because even if your time is approaching for a CDR, you might not get it depending on the budget. But now there's a greater chance you'll get it because they're increasing those CDRs, trying to make it difficult as possible.
Hello, Dr. Weir. My wife is 66 and I'm 58. She's thinking about going on full retirement benefits, but she doesn't know if she has enough credits to do so. Can you please advise us on what to do?
Yeah, if you don't have enough credits, you contact Social Security. If you're the spouse currently collecting benefits, doesn't matter whether she's eligible for benefits on her own record. If she's at least 62 years old, if she's filing for regular retirement or spouse benefit, she has to be 62 years old, and she just go ahead and file. No problem whatsoever. And they determine whether she's insured. If she paid in the 10 years, then she'll get some money. If not, then she won't. And then they'll say, okay, yeah, you're not eligible for benefits on your own record, but your spouse is currently receiving benefits, and let's go ahead and take a spouse claim. So that's the best way to do it. Oh, and number one is to check, make sure she checks her earnings record. Everybody out there should check your earnings record to make sure that Social Security has the correct numbers. Because if Social Security doesn't have the correct numbers in terms of all the money you paid into taxes and FICA all those decades, then if they don't have the correct numbers, if there's something missing there, a gap year or something, then you're not going to get correct benefits for the rest of your life or not be insured. So it's important that you everybody check their earnings record to make sure it's correct.
How do I fill out Form 0960-0555 pain questionnaire?
Okay, so this person sounds like either a CDR or filing a new claim. So yeah, a pain questionnaire looks like you're filing for disability. You're trying to continue your disability benefits. So nobody can tell you how to fill that out. You just be 100% honest. Anything on these medical forms that they request, they're trying to determine whether you have the ability to work. And if you're in a bunch of pain, all day long or whatever the situation may be, then, that's what it's all about. Are you able to work? That's how Social Security defines disability, is the inability to work. So people do this all the time. They try to, stiff upper lip, try to be tough, and veterans are terrible at this. And they try to downplay, oh yeah, I'm missing, both my legs, but yeah, I can still run the marathon. Okay, yeah, prosthetics and stuff like that. But anyway, but just be 100% honest. And the questions are relatively, they ask you systematically, how does that pain, prevent you from working or getting out of bed or doing daily chores and stuff like that. Just be 100% honest. And if for whatever reason you just can't figure it out, for that one, don't call the local Social Security office, because the Social Security office has already moved your case on into DDS, the Disability Determination Service. Okay. They've already moved the case. That's the state agency that makes the medical determination. And they're the ones that sent you that pain questionnaire. So if you call Social Security, they're not going to help you out even if someone picks up the phone, because there's nobody there. Anyway, for the most part. So you need to call DDS. So if you don't know that, you should if you have a pending disability claim, anybody, you should know the first name and the phone number of your claims examiner at DDS. So if you don't, just Google DDS Kansas, DDS Mississippi, whatever the case may be, and it'll give you the 1 or 2 or 3 DDS offices, Disability Determination Services. And you just find the number, call them up, and you say, hey, who's my claims examiner? And they'll ask for your name and your Social Security number, and they'll say, oh yeah, Bob's your claims examiner. Okay, can I talk to Bob? And Bob's probably not going to answer the phone, but you call up and leave a message and say, hey, Bob, this is John from Mississippi, and you've got my case up there, and, got to leave the Social Security number, unfortunately, so they can find you. And I got a pain questionnaire, and I'm having a really tough time with question 17. I'm not really sure how to answer it. And so could you call me back and let me know, and maybe we could talk through it, or, whatever the case may be. That's the best way to do it. That's who you need to reach out to. Don't waste your time calling Social Security, because it's not the case. Your disability case is not at Social Security anymore. It's at DDS. So.
Hello, I'm from Kentucky, and I've been on disability since 2013, and I turned 65 this year. And I was talking to someone at the office, and they said they automatically switched me to regular Social Security, like I'm retired, and not from the SSDI. Is that right? Or is there something that's gone wrong?
That is correct. That happens to everybody. People always freak out when I say this statement, but if you're past your full retirement age, whatever your full retirement age, 66, 67, 65, or whatever, you are no longer on disability. There is nobody in the country on disability, Social Security disability benefits after the age of 67. Nobody. Because you might still be disabled. I'm not saying that. You're still disabled if you're disabled. It's just that Social Security, once you hit your full retirement age, they automatically switch you from disability benefits to regular retirement benefits. And most people don't. That's why people think, oh, Ed's wrong. He doesn't know what he's doing. I'm 77 years old. I'm on disability for 20 years. He's so stupid. He doesn't know anything about anything. I'm still on disability. No, you're not. You're on regular retirement benefits. They switched you at your full retirement age. If you're 77, they probably switched you at 65. And you just didn't even notice. You got a letter, but you didn't understand it, or you didn't get the letter. They just stopped taking your money, your monthly check, which stays exactly the same. They stopped taking out of the Social Security Disability Trust Fund, and now they're taking out of the Social Security Retirement Trust Fund. That's it. But I do one of these videos every now and then to kind of shock and awe people. I sometimes my video thumbnails are clickbait. Yes, I understand. That's what you got to do in this algorithm, this stupid. Anyway, I do a video. I did it a couple of months ago that said 500,000 people will lose their disability benefits this year. And people, oh my gosh, you're fear mongering. No, that is 100% true. 500,000 people will lose their disability benefits every single year, guaranteed 100%, because they're turning their full retirement age. And why do I do shock and awe stupid thumbnails like that? Is because those people don't know it, and it's hurting them because they don't know it. They think they're still on disability benefits at 67 or 68 or 69 or 70. And because of it, they are sitting there day and night stressing about, oh my gosh, are they going to kick me off disability? You're not on disability anymore. You're on regular retirement. They're never going to kick you off disability because they already did. You're on regular retirement benefits. So they're not going to you're not going to lose your benefits because you're not on disability. And the other reason is because now that you're no longer on disability benefits, you no longer have any work limitations whatsoever. You're past your full retirement age. You can work as much as you want. So many people come on here and they say, yeah, I had a friend that's got a little store and she said she was going to, give me a little job. It's going to be super, super easy. I just sit there and watch the register or something like that. But I turned it down because I'm on disability. I don't want to lose my disability and I'm 82 years old. And I'm like, you're not on disability. Take the job, do whatever, go out there. And yeah, so many people are struggling. So if I do a super crazy clickbaity thumbnail every now and then, I do have a reason. So there's a rhyme to my crazy reason, because there's so many stupid videos out there. I've got to get in. I've got to get into. So when another reason I do stupid clickbait videos sometimes is there is someone out there. Recently, there's AI from overseas, and they say you got to do this now, and freaking people out. So I copy the same type of thing in order to get to those same people, and I immediately say, ignore what you just heard. So we got to keep working. We got to get information out there, correct information out there, and I'm depending on y'all to do that. So please share the information with people you know. Okay, let's move on here.
A couple of days ago, you answered a question from a fellow viewer that I can relate to. I'm 65, and due to a job loss, I have taken my Social Security early at the age of 62. Since the beginning of this year, I've been working various contract jobs. Currently, I'm working a contract job and will not be going over the $23,400 by the end of the year, which thank God means that Social Security will not take $1 for every two. My question is, what if I made more than $1,950 for any given month? I made $3,000 in the month of September.
Okay, so yeah, this is a common misunderstanding of the annual earnings limit versus the monthly earnings limit. Let me go ahead and pull up the new numbers. So this is on the Social Security website, Social Security changes, the COLA and all that kind of good stuff. So what she's confusing are these two numbers. Happens all the time. So she's saying, okay, I'm under my full retirement age, I'm currently receiving benefits, so I'm limited to how much I can work. And this year it's $23,400. But one month I made $3,000. Doesn't matter. You can make, let's say you started benefits in January. You can make $23,400 in January alone. January 1st, you can make $23,400. Anything over that for the rest of the year, yes, they hold back $1 for every $2 you go over. What the monthly thing is if you start your benefits, let's say you start your benefits in November, and I'm going to be doing a shock and awe thumbnail tomorrow for our video tomorrow because we need to reach out to people, but it's 100% accurate. So a little bit clickbaity. Well, it's not clickbait, shock and awe type of, yeah. Anyway, but yeah, I'll do that one tomorrow. But 1950, if you start your benefits this month in November and you made, $1 billion up until October, they don't care. Social Security doesn't care what you made before you start your Social Security benefit. So if you made $1 billion up until October, hey, how you doing? You can subscribe and donate. But starting November, that's the question I ask you. Okay, you made $1 billion. Wow, great, awesome. Hey, are you hiring? But we don't care about that. What did you make starting November? Starting November, is your earnings going to be under $1,950? And you say, yes. What about December? Yes. Okay, we can start your benefits November, December. They don't care what you made before that. So a lot of people, and that's what I'm going to be talking about tomorrow, is things that people have to do before December 30th in order to not lose money.
Hello, I am calling because my Social Security payments have been changing each month. In the past, I've been receiving it the second Wednesday of each month. And so the last handful of months, it keeps getting a day earlier. It still shows the correct dates at the Social Security site. So when I go to check my actual payments, it shows the date that it should be paid. So the November payment this month should be put in on the 12th. I received it on the 7th. So it's concerning, one, that it's changed. I've talked with other people. No one else seems to be experiencing this. And
yeah, that's just you're still kind of getting it on the second Wednesday-ish, but it just, Department of Treasury runs because that's the people that pay the actual check. So Social Security Administration tells the Department of Treasury, and Elon Musk didn't understand this. They said, Department of Treasury is paying all this money, but they don't have codes. They don't have the little note thing on the bottom. It's like, yeah, Department of Treasury, they get the orders from whatever agency, the Veterans Administration, the Social Security Administration. Those are the ones that have all the notes while you're getting benefits. So yeah, and there's codes on it. Everybody who received a Social Security benefit, they see that they have, like at the end of the Social Security number has an A or a C1 or a B1 or a W2 or whatever the case may be, and that's the code. So yeah, Elon Musk had no idea what he was doing. Stick to rockets and electric cars, get out of Social Security. But yeah, it's Social Security says, Department of Treasury, pay this person second Wednesday of every month. And if there's on a weekend, then it's a little bit, few days early. And it's also depend on your bank and how soon they process it. So yeah, if you get your check and it's 1 day off, 3 days off, whatever the case may be for a weekend or holiday or something like that, it's par for the course. It happens all the time. So no issues whatsoever.
I have a question for Steve from Texas. Will a disbursement from my TSP account count as earnings that will impact my Social Security payments? I have a loan that will become a disbursement when I retire in 2026.
No. TSP is Thrift Savings Plan. This person is in military or works for the federal government, and that's the kind of the 401k for federal employees, including military. So Thrift Savings Plan, no, it's not counted as earned income. You didn't, you work for it, but it's not wages or net income from business. So it doesn't count against the annual or the monthly earnings limit at all. So no issues whatsoever. Oh, and we've got a really good one here. So okay, let's watch this one. This is a good one.
Okay, Dr. Ed, you asked for it. You want to know what people are doing to help other people in the community. I don't usually like to toot my own horn, and so I'm not. I'm going to toot my wife's horn and show you what she is doing right now to help out the neighbors. As you can see, we set up a little food pantry.
Is that, yeah. I was kind of scared there when I first watched that video. Okay, you asked for it. I'm like, oh my gosh, what's he going to do? So, free little pantry, neighbors helping neighbors. And I can't read the rest, but yeah, we've got some pasta in there, some canned foods and all. Is that awesome or what? Just set it up in their front lawn there. And within 24 hours, looks like they put some stuff in there and other neighbors put stuff in there, and now it's packed. Is that awesome? I wish you would tell me what part. You might not want to tell me what part of the country you're in or anything, but that is awesome. So much negativity on social media about how terrible the other side is, and this is America right here.
And asked the neighbors to help us fill it, and this is what we got within about 24 hours. So I just wanted to let you know that we are trying to do our part.
You are too awesome, and your wife is too awesome, and I'm sure it was husband and wife that did it, and so you're tooting your own horn. There's nothing wrong with that whatsoever. You awesome. Hero of the day, this couple, wherever you are. Thank you so much. We need 340 more million of you. So keep up at it. We've got 600,000 like you in our community, and we're adding people every day that goes out there and helps other people. And so we need more of those. Yes, I asked people if whatever you're doing, whatever your family's doing, you have a friend, you have a neighbor that's doing this, please let's highlight those people and let everybody know that, you know, politicians try to divide us every single day so they can keep as much power as possible. And, you know, that's been the MO for thousands of years. Divide and conquer. That's, you know, goes back to the Roman era. So politicians have been using it on us for thousands of years. And some people outside of our community fall for it, but we don't. So. And guess speaking of the awesome community, this is the young lady we helped that didn't know she collects survivor benefits because of different situations, and she was able to go down there and get a whole bunch more money. So it's a beautiful thing. She was struggling, and she found out because y'all press subscribe and like and share and taught this stupid algorithm to get these videos out to more people, and she was able to see it because of our community doing that, and she got more money. And now she needs a little help with, she has a question about telehealth.
Hi, Ed. This is Tammy again. I mean, Ann. I go by Ann. My question is about telehealth. My current company has telehealth, but I'm not happy with them. And I couldn't get a complete answer or confirmed whether all Advantage plans are still covering telehealth, because I have an immune disability and I won't be able to use my Medicare much if I don't have telehealth. And I'm really concerned about finding one in the next few weeks. When you have chapter on, could they speak to if, because I've heard that maybe they're making changes to Medicare about telehealth or phasing it out. And I also wanted to thank you. I've getting in the process of getting my my late husband's disability, and I got the certificate there and back, and they mailed it back that they've scanned it in. So I'm really looking forward to that. And I love watching your show and passing it to my friends, and asking them to do so also. We're really lucky people to have you do this after retirement with all your, I thank you.
All right. And we love you too, Tammy. And yeah, thank you for checking in. And telehealth, yeah, it's an important thing. They are trying to phase it out. So they said, oh, this was only a temporary thing, during COVID and everything like that, and it's costing us money and yada, yada, yada. So they are trying to phase it out for just kind of general use for everybody. It's kind of going back whether they're successful, and some companies are doing it, some companies are not, whatever the case may be. But in your particular situation, whatever they're trying to do generally across the country or particular companies, your particular situation shouldn't matter. It should not matter whatsoever, because you need telehealth because you're not able to go out because of your immune compromise. So you should be in a completely separate situation. So email me, and we'll have Sarah. She's going to be on in a couple of days here. She's in charge of the team that helps people throughout the year do stuff like this, make sure, the companies treat them right, to make sure they're saving as much money on, their prescriptions, finding a new doctor, fighting prior authorizations, denials, and stuff like that. So she's going to be on here a couple of days, but I want to see if she can address you directly, and see what she can do. So send me an email and make sure I get hundreds of emails, so I want to be able to pick it out. Say, hey, you know me, and I'm asking about the telehealth, and just kind of remind me so I can pick it out of the thousands, and put your name and your phone number. And I think you had called Chapter before. If you haven't, give them a call, and that way they can call you back, or maybe they'll just email you. Or if they're not able to get a hold of you, then Sarah will let me know, and then we'll announce it. But in your particular situation, I would reach out to whatever health insurance, Medicare Advantage company you have, and say, here's the situation. Or if you don't like the one you're currently using, it might be time to search for another company, another Medicare Advantage company in your particular area. So, and remember, a lot of people say, well, I like this company, and I've had them for 2 or 3 years, and yada, yada, yada. That's fine. But a lot of people don't realize the same Medicare Advantage plan, the company, they have several, it depends on your area, they usually have several plans in each particular area. So you have, as I always say, I always get a lot of slack on this one, you have this company, Medicare Advantage ABC company, and you have the 1970 Ford Pinto version, right? And they have just come out with the 2026 Corvette version. And do you want to stick with the 70? Well, you're like, okay, I'm a carburetor guy, so fuel injection. Anyway, but you get what I'm saying. So even if you're with the same company, if you like that company, you definitely want to stay with that company, fine, stay with the company. Just find perhaps a different plan within that company that might save you some more money, get you some more benefits. So yeah, a lot of people miss that. They say, well, I don't want to switch companies. Okay, don't. Just switch plans, because they come up new plans all the time. All right, here is our last question, and then we'll call it a day.
Hello, Ed. I'm Dave from Thomasville, North Carolina. I took early retirement at 62. I'm now 68. And I believe you went over a reevaluation of your earnings that you can request from Social Security through Form 795. I need to find out how much information I need to include in that request, what types of information, etc. If you can expound on that, I would appreciate it. Thank you for all you do. I appreciate you.
All right, we appreciate you as well. Yeah, the 795 is just a general old military. Article 134 of the USMJ is the kind of capture-all form, a blank form. So if you disagree with your benefit amount, then you need to file a SSA 561, a request for reconsideration. But what they will do is your benefit amount is determined on a few things. Let me pull up the slide for the video we did a few days ago. Your benefit amount is, number one, the most important things. That's why I always tell people to check their earnings record. Your benefit amount is based on your high 35 years of earnings. And that high 35 years is indexed. So people, you have to make sure your earnings record is correct, and don't ignore stuff that happened earlier. It's like, you used to work at the local gas station in 1982 and you just made a little bit and it's like $10,000 and you're like, oh, that's nothing. It's only $10,000. So who cares? It's wrong, whatever. No, but it's indexed for inflation. That may be worth like $100,000 today because they index it for like a wage index. So make sure your earnings is correct. So that's how they determine your benefit amount. And then they take the high 35 years, divide it, and you get the average index monthly earnings, and they divide it by these bin points here, which they just do to everybody. But then also, if you ever served in the military, make sure you have your military service down there. But other than that, that's pretty much how they determine. By your high 35 years, give you maybe a few bucks for any military service, you provide your DD-214, and that's pretty much it. And then the COLA, that's automatic. As soon as the Bureau of Labor Statistics comes out with the COLA numbers, that's automatic for everybody, so everybody gets that. But for some reason, you still think your benefit amount is incorrect, then yeah, it's the SSA 561 request for reconsideration. And it's a simple little form. I've got it on my website. Let me pull that up there. So if you go onto my website, mygovexpert.com, and click on the top there, can't see it there. You click on more, you click on appeals, and then it gives you how to request a reconsideration. You click on that and it opens, or you can just, Google SSA 561. And it's a very small form, and you just got these 3 lines. If you've got a deeper explanation of why you think your benefit, your benefit is incorrect, or you were treated incorrectly, or, whatever, you're not getting what you're eligible for, entitled to, what you paid into, then this is the thing you do, request a reconsideration. And if you've got more that you want to include, just on the top here, just put see attached, and then attach a letter, just type up, preferably type it up, because, if you have penmanship like me, then nobody's going to be able to read it. So there's that. So make it easy as possible. All right. That is it for today. I appreciate everybody sharing. My credit union post things a day or two early. Yeah. Oh, speaking of, yeah. If you ever have anybody who's serving in the military, family, or anything like that, Navy Federal Credit Union, I've used them since I was first joined the Marine Corps in 1982. Largest credit union. I'm not giving a plug. I'm just saying. So a lot of people don't realize they can get them. So anyway, here's a big one. Vet Tix. I don't they don't sponsor it, but I've seen so many concerts, free concerts. Vet Tix, VETTIX.org. And you have to prove you're a veteran. So if you know a veteran, tell them to sign up and then get free tickets. I've seen Tom Jones, Tony Bennett. I've seen YouTube. I've seen, oh my gosh, Billie Eilish. Go figure. So all basically for free or $10 or something. Jimmy Buffett, James Taylor. So many concerts for pretty much nothing. So Vet Tix, VETTIX. So if you're not a veteran, find someone who is, hook them up to the website, and then say, hey, next time there's a good concert in town, I'll be your friend. So anyway, so there's that. All right, y'all have an awesome, awesome, awesome day. Please take care of yourself and everybody else around you.